Okay, great. Well, I want to welcome VNA Health to our 60/60 tour for LeadingAge California's 60th anniversary. It is so exciting to have you participate. We have a lot of congregate settings in our communities, and we have some home health and hospice providers. But we know that you're a growing part of our particular membership, and we're so excited because you haven't been part of our membership for 60 years. And we're excited to have some newcomers essentially be part of our tour. And we're really grateful that you both took time out. As you all know, I've known VNA Health for many, many years, way before I should even have known you probably, but many, many decades I've known VNA Health, to the point where I actually know the birds at the airport who come down and it used to attack before they put up all the covering. So with that, let's turn to you, MaryBeth. Maybe you could tell us a little bit about yourself. What's your background? How did you get to VNA Health?
Well, I have been a nurse pretty much my entire life. When I came to Santa Barbara, I was fortunate enough to get into home health care and just absolutely love it. And I have been with VNA for almost 27 years. And wow. I've just enjoyed home health for what we get to bring to our community and to our patients. And it just feels like the real heart of nursing to me.
Well, what's the biggest difference or similarity in 27 years? That's really cool.
Well, I think one thing that comes to me, what we were doing 27 years ago, we're still doing today. And it might be a little bit different sometimes with technology, but we are still providing that hands-on nursing care to people in their homes where they want to be.
So MaryBeth, what are you looking forward to over the next 10 years or so? What do you see the trajectory of VNA Health, and what are you looking forward to?
Well, one thing I think that VNA Health can bring to the community is, with technology especially, is bringing people together, bringing patients together with their physicians, their families, loved ones. We're just seeing that this new trend after COVID-19, I don't think it's going to fully go away. I think that we're going to be continuing to find challenges with technology, and also how to use technology to make healthcare more expansive for people. Without taking away the human touch, because that's what I love about home health care. We get the human touch. We get to see our patients, where a lot of times patients cannot go see their physicians. They don't get to see their families. And also with our Serenity House, and we get to go into the facilities and take care of people. So, and I also think that technology is going to bridge all of that a lot more than we ever thought would ever happen. It's kind of forced us into where we are today in a good way.
So Sena, let's ask you a couple of questions. Tell us a little bit about yourself, and what was your trajectory to get to VNA Health?
Sure. So I'm Sena Woodall. I'm the Director of Hospice for VNA Health, and I've been working here for almost 3 years. I'm actually transplanted from Virginia, and I've been in hospice for going on 4.5 years. Before that, I was an OR nurse for about 4 years, and I did one of those career changes in my 30s to become a nurse, and just fell in love with taking care of hospice patients. And I've really seen how beautiful it is to be with somebody at the end of their life. And when I moved to Santa Barbara, I had applied here and was just excited to be able to kind of be in a nonprofit business that wanted to be involved in the community, have a lot of extra support for community members, and just carries that sort of heart of compassion into everything they do. And so I was grateful to get a job here and have been here ever since.
What were you doing before you were a nurse?
I was a graphic designer.
Wow,
that's advertising.
That's a cool story.
Yeah. My friend of mine was pregnant, and I ended up delivering her son, not having any idea of how to do it. And after it was all over, I realized how much I enjoyed just sort of being there in those sort of moments with people where there's a level of uncertainty, and instinct either takes over, you just know what to do, or you turn around and run the opposite direction. And so I'm one of those that just got really calm and cool, and he was born, and 2 months later I started nursing school.
Tell us a little bit about Serenity House.
So Serenity House is our inpatient hospice unit. We are very grateful to have been given a piece of property and money to help start this Serenity House. It's up on the mesa, so it allows patients to have private rooms where they can see the ocean and, the sunrise and set. And it allows for us to care for hospice patients either as like routine patients that want to stay there, and also allows us to care for our patients who might need some general inpatient care, which I've always described it as it's sort of the hospital for hospice patients. So being in hospice, you want to be able to stay home and stay with your family, and going to the hospital doesn't always line up with that desire. So Serenity House allows us to give them that next level of care without having to sacrifice their home and comfort idea.
Mm-hmm. So what about the future? What are your hopes for the future of VNA Health? And even if you have any tips for LeadingAge California?
VNA is so special because of the support we have from our leadership, from our foundation here. We're able to do these things where I'm sure many agencies are struggling even more so. The leadership here is wonderful. We have so many people that believe in what we do, and every day we're living our mission. And so it really guides us to what we do. So it's not hard. It's like we know where we're going and we know what we want to do. And if there is something that's needed in our community, VNA is usually able to help out. And that's a really special thing to be able to do. Like we've mentioned technology on several levels, and without our IT department, without our finance department to help us, we wouldn't be able to make it happen. So I think going into the future, home care has just grown over the years. People want to stay home, and we're able to help them to do that. So I'm excited to see how that continues to evolve, as it will.
Mm-hmm.